Oftentimes you hear the word conservative therapy. Some people aren't really clear on what conservative therapy is. Now, if you've talked to your insurance company, you know what conservative therapy is because they're going to make you do that before you have surgery or any other larger procedure. Conservative therapy often consists of several potential things. Physical therapy almost always is going to be part of that process. Pain management or control, whether that's narcotics or anti-inflammatory medicines, or simply even some herbal medications that you might use to reduce inflammation. You might need injections, epidurals, cortisone shots, other types of things, traction, core exercise strengthening, stretching, yoga, chiropractic treatments. All these are considered conservative management. Surgery is considered more invasive. So oftentimes in the clinical studies and trials, and if you ever need a surgery, you have to have tried all those things first to make sure that none of them work for you. And if they don't, then oftentimes your surgery is approved or you can go on with surgery as you need to.